this is actually a very well-conducted global trial with the hypothesis to evaluate whether Eribulin was actually going to be better than Capecitabine for patients with refractory metastatic breast cancer. But they did more than that. They actually enrolled patients who were eligible to receive chemotherapy in the first, second, or third line setting for metastatic disease. The results demonstrated that Eribulin was not better to Capecitabine, but it actually, on the other hand, demonstrated that the two drugs appeared to be fairly similar in terms of efficacy, where efficacy was defined as progression-free and overall survival. There was a little bit of a trend, actually, for improvement of Eribulin over Capecitabine, but it did not meet statistical significance. There was another interesting aspect of this study in that investigators conducted subset exploratory analysis, and there were two subgroups of patients who appeared to potentially benefit more from Eribulin compared to Capecitabine. And there were patients with triple-negative breast cancer as well as patients with overall HER2-negative breast cancer. So as I think of potential ways to learn from this study, as well as the take-home messages, I think we can conclude that physicians can now be convinced that there are alternatives for patient management, either Capecitabine or Eribulin. Eribulin or Capecitabine can be used as first, second, or third line setting, although, of course, for prescription patterns, we should follow the FDA guidelines for approval. But in addition to that, I think the results provide ideas for further studies, such as to evaluate Eribulin in patients with HER2-negative or triple-negative breast cancer.